So today my topic is about discussion on fertility of cesarean scar pregnancy treated after high-intensity focused ultrasound. Xilinm Central Hospital is boasting a history of over 100 years. So the history of Xilinm Central Hospital in 2008, our hospital is renamed as Xilinm Central Hospital. Our principle is minimum and non-invasive. So we have made great progress in HIFU. We have conducted cooperation relationship with a lot of hospitals across the world. So our gynecology department is also following the principle of non-invasive and minimum invasive. The introduction of HIFU will be skipped because of you are experts and specialists in this aspect. This is showing the machine of our hospital. So during our discussion, many experts will ask, what's the influence on HIFU on other surgeries? Whether the HIFU treatment will exert impact on other gynecological surgeries. But you see the trend. The HIFU and gynecological surgery are consistent. So they coefficient with each other. So this is the varieties of disease treated by HIFU from October 2010 to February 2023. CSP accounts 31.33% in all the diseases treatment. This is the CSP MRI. Why is this such a high proportion of CSP? CSP is a specific type of ectopic pregnancy referring to the zygote implantation in the scar sites of a previous cesarean section with severe consequences. In China, the CSP is very high. The prevalence rate of cesarean section is 41.1%, and with the rate of the CSP reaching 17.7%. Medication, UAE, ultrasound, DL, DC, and excision hysterectomy are all modalities for the treatment of CSP. We should treat the patients based on the specific conditions of the patients. So how to treat CSP by HIFU? So our choice demand is the lesion size, the gestational ZEC of 15 to 34 millimeters in diameter. The period is 40 to 70 days. And termination criteria for HIFU ablation, the fetal heartbeat ceased, and significant grayscale change in the embedding area, a significant reduction of blood flow signal in the embedding area. The third, a significant reduction in the blood supply in the embedding area. So after the HIFU treatment, the advantages first is less pain and fewer complications. The intraoperative reduction of bleeding. It impairs the blood tissues, and the blood supply was blocked. And the slow decline of serum BHCG, and a faster menstruation recovery in 3 to 9 weeks, and no need to hospitalization or anesthesia. And the left picture shows that abundant blood supply in myometrium of CSP scar, and picture B shows a significant reduction of blood flow in the myometrium of CSP scar. It's impeding the blood supply around the lesion. Over the past decade, there are a lot of studies about CSP under HIFU. We have reviewed 13 articles in this regard. A few cases at the beginning, and with the progress in CSP study. the quantity is improving, and the efficacy and the safety of HIFU treatment is prominent. We find that the HIFU treatment will not influence the function of the ovaries of the patients, with abundant advantages. For those patients with fertility requirements, it can be serve as a primary options for the patients. We have reviewed the 154 patients with CSP during January 2015 and January 2018. They were treated by HIFU followed by USDC, and 28 patients among them wanted to conceive following treatment. So all the patients were followed up for at least 18 months, and the average age is 31 years old, and the BMI was 21.53, and inclusion criteria is that a prior history of CS delivery and exclusion criteria is previous treatment for trophoblastic disease or other disorders. And the treatment was performed using JC200 and with conscious sedation. The patient underwent the HIFU treatment, and we used 6.5 millimeter suction cannula with a vacuum pressure placed in the uterine isthmus. And the ablated trophoblasts and deciduous tissues were detached by carefully and gently moving the cannula around the gestational sac embedding area and gently scraping the residues. And for these 28 patients, 23 embrace pregnancy, and they have conceived after HIFU treatment, and the time to pregnancy is 1.5 years. In 154 patients, 15 are lost, and 139 are followed up. 23 have pregnancy, based on the above-mentioned research. The ages at CSP are between 20 to 40. The treatment for CSP should consider the risks and the lesion and also the complications. And we should also have full communications with the patients before the surgery. Based on the previous retrospective studies, to CSP, we should have early diagnosis and treatment so as to reduce the risk of infertility and recurrent CSP. HIFU, according to our center, is superior to UAE. This is a picture that's showing over 100 HIFU babies are born in our center. We have also conducted research on uterine fibroid, and we hope that in the future we have an opportunity to share with you in treating the uterine fibroid. That is my report. Thank you.